Hello, hello. I think we are live. This is Brent Agin, Dr. A with a Q&A with Dr. A. Haven't been here in 2 weeks, so we're trying to kind of spread them out a little bit, but definitely was excited to talk to everybody again today. Today is actually Doctor's Day, which is kind of cool. So we kind of thought that it would be a good time for me just to talk a little bit about medicine, doctors, health, wellness, kind of what led me to this point in my career and how, how my passion has really led to the development of telewellness and, in being able to try to help more people than just in my, local practice here. So just a little bit about me. And I think you'll be able to get a little bit of a better understanding of how I got to this point and where my passion lies in medicine and for the reasons why. But for those that don't know me, my name is Brent Agin. I am I'm a medical doctor. I was originally uh, did my board certification in family medicine. I did my residency here in Clearwater, Florida, but I did my medical school and undergrad at Michigan State University. My desire to get into medicine and become a doctor was really just started out because I liked people. I was a college athlete, so I already was interested in nutrition and fitness, and then and I like science. And so, that kind of led me down the path of moving into medicine. And then, from that point forward, has been really an interesting journey, just because when you're really focused on nutrition and wellness and trying to maximize your potential, which is really what the mindset of an athlete is, it's all about numbers. It's as you're an athlete and you start going through from youth sports all the way up into collegiate sports, and then of course up into professional sports. It's all about numbers, and you're basically kind of in a funnel in a sense. And that's what I always try to explain to people is that you start out working really really hard, and that you start to get into this funnel where it gets a little bit harder and harder and harder for you to reach the next level because the competition gets more fierce. The dedication, the discipline to be in that position. How hard are you going to work? How hard are you working on all the different things that make sense to you? And it gets, as you get through that funnel, the difficulty obviously becomes apparent when people start, dropping out, getting cut, not making it to that next level. And so, the mindset is that, you have to work hard. You have to work really hard if you want to achieve these goals that you set for yourselves. And so, having that mindset and getting into college and playing a sport, and then having to really work hard to actually to actually get minutes on the field, you start to develop a sort of a real sort of understanding of what the body needs and what you physically need to do to maintain goals. And so having that attitude when I got into medicine, I wanted to carry on those types of ideals, work ethic and understanding of the body, and especially not just cosmetically, but for to try to maintain that level of health and wellness and drive as long as you can. And and then you look at your parents and people around you, and you start seeing the different approaches to health and medicine. And so by getting into medicine, I saw myself being able to get into this position where I could really really help people try to live their best lives. And so as I got into traditional healthcare path, which you start to realize that that's not that's not what you're taught. So my direction in medicine really started to take a real different turn once I got into my residency training and started realizing that um, I was spending more time, on administrative different actions and didn't really have the amount of time that I needed to really make a difference in people's lives. You need time. You need to sit down. You have to learn each person, and that's kind of what led me into a path of medicine that's more individualized care. And so, it's very different from traditional health traditional medicine and traditional doctoring. But it was the right path for me, you know. So I had to kind of exit traditional medicine and then start looking at some very non-traditional approaches, but were very made common sense to myself, which was, you know, where is all the education on fitness and nutrition, you know, sleeping, you know, nutritional supplementation, where is the focus on how we look in our self-confidence and our self-esteem, and it just, there was really no focus on any of that. And so that's what I set out to do. You know, I wanted to target the people in for my medical practice that were committed for change, and then they wanted to hit that maximum vitality. They wanted to age as best they can. They're willing to put the work in to achieve the goals that they want. And so you could see that, you know, it's a numbers game again. When you look around, you know, you can take your age and look around, and if you find other people that are your age that have more energy than you do, that look better than you do, that are in successful jobs or great relationships, or you know, however you want to look around, there's work that needs to be put in to attain that. And that's kind of the definition of wellness is not just health. Wellness is a whole collection of your life. It's basically, you know, it's prosperity, it's spirituality. Of course, health is a big part of that, but it's relationships, experiences. And so that is what I really wanted to be involved in. Is that I wanted to help people with their wellness, because you know, staying healthy and taking care of colds and sinus infections and toe fungus and things like that. Yes, it's helping people, but that isn't what I got into medicine for. I got into medicine to help people reach levels and potentials that they didn't know they could reach, or they were struggling with, but really wanted to get there. And again, putting the comparison to sports. It's a really easy way for me to look at it, is that I want people to be on that professional team. You know, I want them to get the minutes on the field. I want them to put the efforts in to get what they want out. And so it starts with setting goals. And so when people come in to see me, that's kind of where it starts, is, you know, what do you want? What are you looking for in life? I mean, what are you really trying to get out of your, you know, whatever chapter you are in. And so that's kind of what led me into this whole path. And so, you know, it was quickly, you know, 3 years of residency, and then I was off on my own. And I've kind of told people that really don't know me that, you know, I basically spent 20 years as an experiment. And the experiment is basically saying, okay, well, what are all the things that are out there, that can lead people to the best opportunity to be free of disease, and maximize their potential. And so telewellness is basically just an opportunity for more people than in my you know, local area, to be able to find solutions that will fit, and support their lifestyle, so that they can reach these goals that they want. Because truthfully, we're all capable of doing pretty much anything we want. You know, if you set goals, you can achieve them if you set your mind to them. Obviously, you know, we can't, you know, set unrealistic goals. You can't say, hey, I want to be 6'5" when you're, you know, 40 years old, because that's impossible. But when you set realistic goals, and you know, throughout, whether it's a health goal, or it's a work goal, or it's a relationship goal, you know, you're going to have tools to support that. And so my medicine is, you know, there's so many different terms for what type of medicine I practice. Even my kids ask me, you know, what exactly do you do at work? And it's kind of hard to explain, because you know, we're taught or brought up through a healthcare system that is basically, hey, when you get sick, go see a doctor. If you have a problem, go see a doctor. And so we're kind of exact opposite, is that, you know, what we try to do in our medicine is try to prevent you needing to go see a doctor. And again, why it's so heavily, surrounded by healthy lifestyles. And so when you know, there's names like functional medicine, there's you know, wellness medicine, in I can't think of the other term, but so it really doesn't matter what the name is. It's just the fact that you're doing what is necessary to keep people as healthy as possible. And when you have not enough focus on exercise and diet and nutrition, and even sleep and hormones and things like that are extremely important for our bodies to work the way they are, it that is when disease occurs. And so, we're kind of that traditional philosophy of waiting till you're sick doesn't make any sense to doctors that are trying to prevent disease. And so that's kind of what led me down the path. So over the last 20 years, I've continued to try to challenge myself to stay as youthful as possible. And it's you can only do so much, but there is a lot that people can be doing, and I challenge people to take pride in their presentation. We are an outward expression of our disciplines, and so when you walk around and you're walking down the street, or you're in a store, or you go to an event, people are going to look at you, and unfortunately, whether it's right or wrong, they're going to look at you and they're going to be able to say, somehow, some way, be able to tell what your investment in yourself is. And again, it's not saying that it's right or wrong for people to do that, because everybody, people we're humans. We have hearts. We have families, and of course all have great attributes and characteristics that are important. But when you really get down to it, you have one chance at life, and you have one thing you can control, and that's yourself. And so, I like non-traditional medicine, because it is again, it's pushing people to challenge themselves and to try to be in that top percent. And there's nothing wrong with that. And so, when I use that analogy of sports, and making that team that you want to make, or not getting cut, or getting playing time, or making it to that professional league. It's all about numbers. It's all about percentages. And so, that's the way you're looking at life right now. I mean, right now we are in a health crisis. And when you look at the percentages, they're very sad. I mean, we're to a point now where the majority of our population is sick. And so when you think about that, and you think about yourself individually, you have to look and say, well, what can I do differently? Where am I in this percentage? Where am I in that funnel? And if you're stuck, way up at the top of that funnel, you're probably not going to get through the hole. And and so, challenging my clients to look in the mirror, and look at their lifestyles, and look at what their goals are. If you don't mind, being in a certain percentile, then that's fine. That's not the type of people that come to my clinic, and that's not the type of people that are coming to our telehealth site. We are a site for that percentage of people that want to be in that top percent. And in the byproduct of reaching that top percent is invaluable. It's priceless, because when you really, the people that finally understand the value of really investing in yourself, are the ones that usually, get hit with some sort of catastrophic health event, and they sort of, just realize, going, wow, I could have done things a lot differently. So that's the unfortunate part of it. And there's some people talk about life, and the average age person that comes into my clinic, and that goes through Telewellness MD, is about, it's probably an average age of around 50. And that age is when people really recognize, some philosophers say that you have two lives. The second life starts when you realize you only have one. And it's kind of a deep thought, but yet it makes complete sense. Once we understand our mortality, things change. People start to get nervous. They start to wish that they had done things differently. And so that is the part where you have to realize that, and take pride in the way you present. So if you work really hard at investing in yourself because you are the only one that you can control, you get the benefit of reducing your chances of disease. You get the benefits of increased energy. You get the benefits of decreased hospital bills, pharmaceutical bills, and of course, just obviously having an extended health span. People a lot of times don't realize that living is only really good when you're healthy, because you don't want to live to your 90 but only be capable of enjoying life until you're 75 and you have 15 years of really just a lot of medical care and hospitalizations and debilitation or disability. That's not the goal. And so when you guys, evaluate yourselves, which you should do often, and kind of look at where you are on your health status, compare yourself to other people. I mean, look around and see, your peers, your friends, your family members. Look around and see people your age and say, where am I at? And you're basically going to make a decision saying, am I in the top percent or I am in the bottom percent? And if you're a competitive person at all, or if you have self-esteem, or you should be able to identify where you are in that. And then if you're not in that position, then do something about it. It's never too late to make change. And every time you decide to make a change in your life, it is going to reflect in you feeling better, and then it's going to start turning and putting you into a positive health cycle. And the other thing about this type of healthcare in this is that the benefits of being healthy, again, is that you start to realize that internal energy is what really provides your path and your direction in life, and the people you meet, the opportunities that become available, all depends on energy. And so as you start making positive changes for your health, you have an energy. I mean, we're all matter in a sense. And so those of you that believe that we all have an internal energy, and like energies naturally attract, you'll understand why the importance of taking a path of some sort of self-fulfilling or self-directing a path of health and wellness. And so it's extremely powerful. And so the tools are there, and we have a lot of different things available. And we've spent a lot of time. I mean, the people that have worked with me, I have some staff that if we've worked together for almost 20 years, and we have spent endless hours looking at everything out there and everything that's available for people to reach that vitality, or reach that that health status that they want to be at, where they're comfortable, where they're confident, where they're happy to be outside, they're happy to be at parties, they're happy to be around people, because they feel good, they look good, and people can sense that vibrance, and that's that energy that we're talking about. So don't let yourself wait to be sick. You unfortunately are going to have to look outside of traditional healthcare, because traditional healthcare is set up for really focusing on people when they're already sick. So there are a lot of books out there. There's a new term that's surfaced over the last few years, which is called biohacking or self-hacking, and all that is people that aren't in the medical field that are understanding that there are a lot of solutions out there, and some of them are hard to navigate to see exactly what is real, what is good, what is best practice for you to reach certain goals. But that's all it is biohacking is basically looking at how you can manipulate your internal environment. So that's everything into your complete body and your health in your organ systems, and your external environment, which means who are you surrounding yourself with? What are your external activities? What are your habits? And basically manipulating both of those to reach a point of vitality, or energy, or vibrance that is unmatched, because the average person has untapped potential. And so when you look at some of these really important people that are out there that we can actually have access to. Joe Rogan, Joe Cohen, David Asprey. These guys are, what they call biohackers, and they go to conventions and conferences just so they can share all the different options and tools that are available out there that they've utilized to get to a point where of clarity and energy that they didn't think they could achieve. And so once they reach there, of course, they want to share their story, very similar to myself. And so what you're going to find in these biohackers is that alternative medicine, functional medicine, wellness medicine is very similar to biohacking. It's just now we're having the ability to bring in some prescription therapies that can help in that, and for those people that want to be on that path. But it really is an experiment or a project that these people have taken on to go out, interview, and try all these different therapies to see which ones cause the best result, and then they share that with people so that they can start to do that themselves. And so it has really been a nice for me and for other functional medicine doctors, wellness doctors, to see that there's this movement of people that are out there looking to find these solutions so that they can best tap into their all their different potentials, and that includes brain health, so it's both mental and physical health. And so you can see that over 20 years I have applied and tried so many different things in my career, both on myself and with patients, obviously safely. But there are a lot of things that don't work. There are a lot of things that work great. And so what we try to do is provide, best practice. And so when you see things that that I'm talking about on these Q&As, or any of the literature that I put on on the TeleWellness website, you're going to know that this is stuff that I've researched. I don't put things. I don't write about certain products, and I don't use certain products myself, and I definitely don't push products to my clients that I feel are ineffective, unsafe, or are not going to provide some sort of a benefit. So we've done a lot of that research for you, and so now it's just really focusing on what you can control, and that's your lifestyle. So kind of a synopsis of all this is that my choice to get into this type of medicine was because it was the only medicine that I really wanted to practice. And I needed time. I needed to be able to sit with people. I needed to have that individualized experience where I could really understand where people were struggling, what their strengths were, what their goals were, so that we could set a plan out for them to actually be able to achieve them. Because if you don't if you don't have that guide, it can be very hard for people to to break out of that the mold that they're in, and it can be very stressful. So again, everything starts with lifestyle. And so for me, it was taking medicine that I already knew, and then going out and finding all of the other options out there that can make that type of medicine better. And so you're going to just hear me say it every time, is that lifestyle is the best medicine. And so you guys have to start with the things that you can control, and surround it with various products and services that are going to allow you to basically reach your goals quicker. And that's going to be sleep, diet, exercise, optimizing hormones if you're at an age that it makes sense, or and correcting micronutrient deficiencies. But if at any point, if your sleep's good, your diet's good, your exercise is good, and you're just not feeling well, then you obviously have to consider hormones or micronutrient deficiencies. But there's a good range of supplements that you can take on a day-to-day basis. But and then it's just being disciplined. And so I'm really excited that I chose to follow this career path, because it has been extremely rewarding, both for my own personal health, my family, people around me, and obviously my clients. And so, at this point, through our telewellness platform, we have all these same exact solutions that we're utilizing in our practice are available. There's a lot of information about them and how they work. We have medical support for people that have questions about these therapies. But you have to have attention to these details. I mean, it's very important for you guys to understand that you have to be committed and want change. You can't expect to reach the goals you want doing it 50%. You just can't. And it's just like the same thing with sports. You go in practicing and thinking you can go in working 50%. Well, there's someone else over there working 100%. And that's why you're going to get stuck at the top of the funnel. You're going to get cut. You're not going to make it to that next level. So if you want results, if you visualize how you want yourself to look and feel, if you want to see yourself being happy, you want to see yourself having all of this energy, it is 100% achievable. It's factual, and it doesn't matter what your weight is, what your exercise regimen is. Everybody can reach a higher level of energy and even cosmetically, but both mental and physical energy can be increased by everybody. And a lot of times people think that they feel good and they just have no clue how good they can feel because they haven't put the different tools in place, or for them to reach that. So challenge yourselves. That's the biggest thing. Is if you're not at your ideal weight, you're already a statistic. If you're on multiple medications, you're already a statistic. It's not saying that you can't, that you might have to be on medicines for certain conditions. It might mean that you're not ever going to get to a certain weight, but you know what? You can set some goals and at least try to achieve them, or attain certain goals. But don't set your goals too low either. I mean, put the expectations high. It's not a sprint. This is a marathon. This is your life. This is your one chance at basically getting yourself to the point where you want to be. So, if you got to start somewhere, and so everybody can achieve it. And so if you guys have any questions, any topics that you want us to cover, utilize us. We have someone available during the day to take medical questions. If you have any questions about our different therapies, if you have something specifically that you want me to talk about, I can talk about a lot of different things, and if I don't have the answer, I will look it up and find it. But like I said, I've been doing this for a long time, so there's not a whole lot that I can't have a conversation about if it has to do with therapies that are going to improve either our mental or physical wellness. So again, make the change, make the commitment. Life is precious. Life can be very short. Time is the most valuable asset. And for any of you guys that are not feeling absolutely is the best you can, if you're not waking up in the day going, God, I feel good, then you need to start doing something immediately, because you are wasting time. And when you reach that level that you want to be at, everything makes sense. And I can promise you, if you work really hard, give yourself 3 to 6 months and put your efforts into it, and you will be reaping the rewards in so many different ways, in so many different fashions, that it really is priceless. So again, this is Doctor's Day, so I just wanted to really just kind of give an overview of what motivated me to get into this type of medicine, and explain to you guys out there that you can achieve anything, you're capable of anything. Don't wait till you're sick, because you're going to regret it. This is the time to put the work in so that you can remove those risks of having some disabling or catastrophic condition, and basically just really focus on energy and experiences and really enjoying life. So we'll see you at the next Q&A with Dr. A. Remember, if you have anything that you want to discuss, we have medical support. If you want me to cover a specific topic, just let me know and I will cover it. And we will see you in 2 weeks. Thank you guys. Have a great rest of your week.